Welcome to my journal contribution. What is the aim of the research? To examine the socioeconomic status, time-related factors associated with less healthy food purchases in Australia. The study looked at variables that impact household food expenditure, such as socioeconomic status, being education, income and geography, time constraints, and the impact it can have on food expenditure and healthy eating. According to WHO, the social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live and age, and the wider set of forces and systems shaping the conditions of daily life. The research identifies associations between the portion of household food budget spent on various food types, unprocessed, processed, takeaway and restaurant foods, socioeconomic status, and time constraints. According to Australia's Health Report in 2016, socioeconomic factors are important determinants of health and well-being in Australia. The higher a person's income, education, or occupation level, the healthier they tend to be, a phenomenon termed as the social gradient of health. The study focuses on three measures: education, income, and geographic area that may be linked to less healthy food purchases. Key health inequalities associated with time constraints when working include full-time working employees being associated with spending relatively more of their food budget on takeaway foods than part-time working households. Households with longer working hours resemble households with the highest income, who relatively spend less on a range of unprocessed foods like fruits and vegetables compared with non-working households. Key health inequalities associated with geographical area include wealthy, highly educated, and least disadvantaged households spending less of their total budget on home-prepared foods and more on foods purchased away from home. Key health inequalities associated with education include higher educated households allocate more to fruit and vegetables in their food expenditure than low educated households. Key health inequalities associated with income include household income being importantly associated with food expenditure patterns when all other socioeconomic status indicators are controlled for. Lower socioeconomic status households tend to spend less of their total food budget on restaurant foods in comparison to higher socioeconomic status households. The general perception is that lower socioeconomic status householders allocate proportionally more of their food budget on unprocessed and processed foods consumed at home and less to eating out to limit their food expenditure. However, this study highlights the importance of considering multiple indicators of socioeconomic status simultaneously. The relationship between socioeconomic status and food expenditure are lessened by controlling time. Suggesting a lack of time among wealthier households explains part of their expenditure decisions relating to food. Differences in working hours can also lead to differences in time constraints. Households with full-time work are associated with lower expenditure on healthy foods and higher spending on takeaway foods. Eating out reflects long working hours more than high income. The study states to save time and effort, richer households tend to spend less of their budgets on foods to prepare at home and instead invest on pre-prepared meals and dining out. Looking at processed and unprocessed foods, more disadvantaged households are spending less on fruits and vegetables than on other unprocessed foods. The possible reason for this is that lower socioeconomic status households prefer not to waste money on fruits and vegetables that may be thrown out. In relation to the social gradient and food expenditure patterns, the wealthier, most educated, and least advantaged households spend less of their total food budget on home-prepared food and more on foods purchased away from home. In relation to income, household incomes exhibit the most robust relationship with food expenditure, suggesting access to financial resources plays a stronger role than education or geographically availability of food. So what do the results of the study suggest? It highlights the importance of considering multiple indicators of socioeconomic status simultaneously instead of individually to inform public health policy. The study looked at variables that impact household food expenditures such as socioeconomic status, like the role of education, income and geography, time constraints, and the effect it can have on food expenditure and healthy eating. The results of the study are from trustworthy and reputable sources. However, there are many confounding factors present. Data was used for the 2009/10 Household Expenditure Survey, conducted by the Australian Bureau of Statistics. It is said to have included 97% of the Australian population. However, those living in very remote areas were excluded from the scope of the survey. Food expenditure was separated into 4 categories: unprocessed, processed, takeaway, and restaurant foods, which allowed for the observation of household food consumption. The method of data collection on food and beverages using a 2-week expenditure diary may not account for all food patterns by various households. However, it does paint a general picture of the social gradient of health and household food expenditure. Socioeconomic status information on education, income, and employment was collected through personal interviews with each adult household member. The study highlighted a sample size of 9,725 households being used in the survey. However, does this sample size account for food expenditure in Australia, as the title of the study suggests, or are the results generalised? Time constraints were measured through the Australian Time Use Survey. The survey showed the percentage of Australians who often feel rushed for time in socioeconomic status factors such as education, income, and geographical disadvantage. There is no direct measure of household time constraints in the HES survey. Hence, it can only be concluded that the possibility of the socioeconomic status gradient in food expenditure may be driven by time constraints. The author's recommendations in the studies are associated with time constraints, nutritional education, and considering multiple sources of disadvantage. The authors of the study suggest that time is an important resource of health, as those in advantaged socioeconomic status groups typically reported higher rates of time pressure, which then contributes to consuming less healthy diets. Another recommendation is that more nutritional education, especially among those with less educational qualifications. Although research found that lower socioeconomic status groups knew the basics of good nutrition, they did not necessarily adopt this information in the same way. The paper identified this could be because highly educated groups are able to prioritize their health decisions due to their earning capacity. This highlights how policy implementation depends on characteristics of the socioeconomic group in question. Another recommendation from the authors of the study is when considering policy options in response to unhealthy diets, policymakers should consider multiple sources of disadvantage instead of only focusing on isolated socioeconomic status indicators. A single indicator response is a less effective approach when considering policy options, as they only provide individual dietary health risks, whereas considering multiple sources of disadvantage provides a holistic approach to policy. The findings of the study can help health professionals be aware of the possible factors that arise when making food expenditure choices between the different socioeconomic status gradients. Health professionals can use these results of the study to target their health advice to households in an attempt to help them achieve better health outcomes. The government can use social practice research like this study when making health policy decisions, realigning public health research towards understanding how behaviours are modified by daily schedules, routines, household dynamics, and time use can help inform public health strategies and reframe narratives around consumption-orientated lifestyles. Thank you for listening.